Hello, I'm Dr. Kirk Churukian, a board-certified plastic surgeon practicing here in the Greater Bay Area for the past 15 years. Thanks for joining me for another in a series of programs exploring topics in cosmetic and reconstructive surgery. Breast augmentation is one of the most common procedures that we do here at my center. Typical candidates include women from 20 to 70, and while their circumstances vary, the ultimate goal is the same: to look better and feel more confident about their appearance. Today, I'd like to briefly introduce you to breast augmentation and our rapid recovery system, a system that makes your recovery as brief as the weekend. I'll touch upon implant styles and shapes and the different materials available. I'll also discuss the approaches and placement of the implant. And finally, as mentioned, we'll discuss our rapid recovery system, what to expect after surgery, and return to activity. So let's get to it, shall we? Breast augmentation is always a personal decision that should be made by you and for you. I and my staff will help you to make decisions about the type of implant, the size, the positioning, and the surgical approach. Together, we will help you make the best decision based on your personal goals for the surgery. First, let's briefly talk about the available implants. There's the traditional saline model, which is best for patients with ample breast tissue to cover the implant. This is a great option for our younger patients who have not had children. It is the least expensive, but also the least natural feeling implant. Next, let's discuss gel implants. Gel implants are available as standard cohesive gel implants as well as highly cohesive gel implants. Both are designed to minimize the leak of gel should the outer shell rupture inadvertently. In general, gel implants are an excellent choice for patients with very little breast tissue or volume loss during childbirth and breastfeeding. They will provide the softest texture, the most natural feel, and the best overall appearance. The highly cohesive implant is slightly firmer than the standard cohesive gel and is also available as a shaped or anatomic style implant. Additionally, both implants come in low, moderate, and high profiles. Implants are chosen based upon your native breast shape and size and your overall goals for the end result. Choosing a surgical approach and deciding on placement of the implant above or below the pectoral muscle is another very important part of the decision-making process in implant surgery. Placing the implant under the chest muscle will provide a thicker tissue over the implant, creating a softer and more natural appearance. Some patients, however, will obtain a better result with placement over the muscle. These are patients with a mild to moderate amount of sagging who do not desire a lift, or those who have had prior scarring of the submuscular space, or those with a generous amount of their own tissue with which to cover the implant. Incisions for the placement include the bottom of the breast in the lower fold. The other approach is at the border of the areola, and finally, an approach can be made through the armpit. Studies have shown that the complication rates, including loss of sensitivity, infection, and bleeding, are not affected by where the incision is placed. Rather, the decision is simply where you would like to place the small and inconspicuous scar. Once you have made these important decisions, then our work really begins. There is the surgery, the recovery, and the aftercare. All procedures are performed at VIP Surgicare, our on-site, fully certified and accredited surgical center. Here, our team consists of experienced nurses, surgical technologists, and board-certified anesthesiologists, all dedicated to one goal: a superior outcome and a wonderful overall experience. Immediately after your surgery, we will begin you on our rapid recovery system. Special exercises and massage techniques allow you to have a relatively normal day, but with less pain and limited need for narcotic medications. This means you can go shopping with friends and family, out to lunch or dinner, or easily accomplish routine tasks around the house. Return to driving and work activities is in sometimes as little as 3 days. We follow you closely after your surgery, and when you're feeling better, we'll check you at 3 months, 6 months, and 1 year. We then give you the option of being seen on a yearly basis for an annual checkup. Breast enhancement can look as natural or as supernatural as you wish. Either way, you will have the confidence you need to feel and look your best as you walk into that next big event or business meeting. I hope this information has been helpful to you and will give you a start as you research breast augmentation. I also invite you to set up a consultation time to allow us to talk to you about your goals and discuss what procedure may be right for you. My staff and I are committed to providing you with thoughtful and compassionate care, so please let us know how we can help. I'm Dr. Kirk Churukian, board-certified plastic surgeon. Thanks for listening to this Plastic Surgery Minute.